of the gland, which secretes the catecholamines epinephrine and norepinephrine. Since other body tissues also produce catecholamines, the adrenal medulla is not essential for life. The adrenal cortex, however, is the only gland that secretes certain essential hormones. Aldosterone, for example, helps maintain fluid balance by retaining salt in the body, and the glucocorticoids are involved in sugar and protein metabolism, maintenance of blood pressure, and the body's response to physical stress. They also play a part in the intricate feedback relationship that triggers the release of certain pituitary hormones. Two adrenal gland disorders we'll review are Cushing's syndrome and Addison's disease. Let's begin with a brief description of Cushing's syndrome. Cushing's syndrome, also called hypercortisolism, is a relatively rare condition that results when too much adrenocorticotropic hormone, or ACTH, is produced. This can result from an adrenal tumor or from prolonged administration of corticosteroid therapy. Both conditions result in increased levels of cortisol, which suppress the adrenal gland. The signs and symptoms of Cushing's syndrome include an accumulation of fat, especially in the trunk, face, neck, and what's called a buffalo hump between the shoulder blades, muscle wasting of the extremities, a ruddy complexion with a moon face, abdominal striae, hyperglycemia, excessive hair growth in women, and thin, easily bruised skin. Bone demineralization, hypertension, and electrolyte imbalances are also common. Now that we have discussed some of the signs and symptoms, take a minute to see if you can think of some nursing interventions for clients who have Cushing's syndrome. You'd monitor the client's intake and output and weight. Also of high priority would be to assess for signs of infection and to monitor glucose levels. You'd also provide emotional support related to body image and mood swings, promote skin integrity, prevent injury, encourage a high-protein, low-calorie diet, and teach the importance of not discontinuing corticosteroid medications abruptly. To better understand clients who have Cushing's syndrome, let's take a closer look at this situation. FJ, a 62-year-old client, has been taking 10 milligrams of prednisone, PO, for over 2 years to control pulmonary inflammation from chronic COPD. When assessing her, the nurse notes that she has a round, puffy face, a large abdomen, and thin arms and legs. There are multiple bruises on her arms and legs. What is the relationship between FJ's chronic use of steroid drug prednisone and her physical appearance? Prolonged or excessive cortisol intake alters the metabolism of proteins and carbohydrates, fluid and electrolyte balance, immune response, and other metabolic functions. Altered fat metabolism causes an abnormal accumulation of fat on the back and face, producing the buffalo hump, moon face, and truncal obesity. Altered protein metabolism produces protein breakdown and subsequent muscle wasting, manifested in thin arms and legs. Cortisol causes veins to become fragile and skin to lose elasticity, resulting in thin skin that bruises easily. Most cases of Addison's disease are caused by the gradual destruction of the adrenal cortex, the outer layer of the adrenal glands, by the body's own immune system. In fact, about 70% of reported cases of Addison's disease result when the immune system makes antibodies that attack the body's own tissues or organs and slowly destroy them. Adrenal insufficiency occurs when at least 90% of the adrenal cortex has been destroyed. As a result, often both glucocorticoid and mineralocorticoid hormones are lacking. The signs and symptoms of Addison's disease progress slowly and might not be evident until some sort of stressful event, such as an illness or accident, occurs. Symptoms include any or all of the following: chronic worsening fatigue and muscle weakness, loss of appetite and weight loss, nausea, vomiting, and diarrhea, low blood pressure causing dizziness or fainting when standing, Skin changes, including a darkening of the skin, like a suntan, most visible on scars, skin folds, pressure points such as the elbows, knees, knuckles, and toes, lips, and mucous membranes. Irritability and depression, salt loss causing a craving of salty foods, hypoglycemia or low blood sugar, usually more severe in children than in adults, and irregular or absent menstrual periods. Based on the symptoms we've just outlined, let's see if we can think of some nursing interventions for clients who have Addison's disease. Monitor vital signs and pay particular attention to changes in blood pressure while the client is sitting, then standing. Monitor weight and intake and output to evaluate losses associated with nausea, vomiting, and loss of appetite. Assess the client's skin for changes in pigmentation. Question the client about any perceived problems with irritability and depression. Monitor blood sugar levels to identify difficulties with low blood sugar, and teach the client the importance of the medication regimen. Treatment of Addison's disease includes medications that will replace or substitute for the hormones not being produced naturally. If aldosterone is deficient, it is replaced with oral doses of a mineral corticoid called fludrocortisone, acetate, or Florinef, taken once a day. Clients receiving aldosterone replacement therapy are usually advised to increase their salt intake. Cortisol is replaced orally with hydrocortisone, a synthetic glucocorticoid, taken once or twice a day. It is crucial to instruct the client to carry an identification card stating the condition in case of an emergency, instructing emergency personnel to inject 100 milligrams of cortisol if its bearer is found severely injured or unable to answer questions, and including the name and telephone number of the physician and the family member or friend to notify in an emergency. Carry a needle, a syringe, and an injectable form of cortisol for emergencies when traveling. Increase medication during periods of stress or mild upper respiratory infections, and get immediate medical attention for severe infections or vomiting or diarrhea.